Good afternoon, everyone. We are excited to welcome you all to another inspirational and educational episode of Concorde Conversations. Concorde Conversations is an initiative by Concorde Medical Group to educate, empower, and encourage our community about our health so we can all live to our fullest potential. Today's episode is When It's Not Normal, a discussion about uterine fibroids. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program at Concorde Medical Group, Northwell Health. And today we are joined by our outstanding colleagues from Concorde Medical Group, part of Northwell Health, and faculty of the Zucker School of Medicine at Hofstra University. I would like to introduce you all to the amazing general gynecologist, Dr. Rachel Friedman, and minimally invasive gynecological surgeon, Dr. Veronica Lerner. Both are board certified physicians. Many of our Concorde community have submitted fascinating questions for us to answer today. If you have any additional questions, please ask them in the chat box. We only have 30 minutes together, so we're going to go through as many as we can. Remember, we are giving general guidance. If you have a particular question about your health, we would like to help you. So come in and talk to our exceptional Concorde physicians so we can answer your questions and give your health the attention it deserves. Let's get started. Welcome, Dr. Lerner and Dr. Friedman. Dr. Lerner, what are fibroids and how common are they?
Thank you so much for the opportunity to be here. I really appreciate this chance to reach out to the community and make sure that women get care in a timely fashion and that their concerns are addressed. Well, fibroids are extremely common, but the short answer is that they're benign tumors. They typically arise from the cells that line the wall of the uterus, and they slowly grow over time, often under the influence of estrogen that comes from the ovaries. So it's a common benign tumor, and we see a lot of patients with this condition.
Okay, Dr. Friedman, what are the symptoms of fibroids and when should a woman go see her gynecologist?
Well, I kind of think about fibroid symptoms as sort of two different categories. There can be symptoms that relate to bleeding, and then there can be symptoms that relate to the size of the fibroids, or what I call like bulk symptoms, the way that they, are the way that they grow and how they impact the organs around them. So people can have irregular or heavy bleeding. And, it's really hard for people to determine that on their own. I think like people get used to just knowing what their cycle is like, but people don't always know what's normal and what's not. So that would be something that you should come bring to your gynecologist to talk about, because a lot of people live with stuff that they think is normal because it happens to them. But then when they tell me, I'm like, that might be, you could maybe do better than that. So the bleeding, heavy bleeding, anemia. Bulk symptoms would be things like bloating, pressure, maybe pressure on the bladder. So it can be some urinary symptoms, urgency, frequency, some bowel symptoms like pain with bowel movements, or constipation. People can have a lot of different symptoms from it. And so I think, in general, that's the broad category, but if you're not sure, bring it up because there are other ones too.
Okay, Dr. Friedman, one patient asked, can fibroids cause weight gain or a distended abdomen?
I mean, they can get fairly large, and they can cause people to feel like their clothes don't fit. In fact, even so if your clothes don't fit and it's not because you've gained weight for a reason that you're clear about, that would be a reason to come in to see your doctor, because there are a lot of things that can exert that effect that would make you feel like, kind of bloated or more broad. That would be important to come in for. And some people's uteruses from fibroids are so large that they almost can appear like pregnancy size. Like I have patients who have large fibroids who get seats on the subway, like, just from their fibroids. So they can look quite large. And the size is somewhat important. Now, there are a lot of people who it's medically appropriate for them to walk around like that, but that's just something you decide between you and your doctor.
Dr. Lerner, how do you diagnose a fibroid?
Women often will come and they say, oh yeah, I'm glad you asked me about this. I've been having heavy bleeding for a couple of years. I just kind of blocked off, or I didn't think it was important, or I've been having pressure and discomfort, or maybe I had some pain with intercourse, but I didn't really think of it this way until you actually asked me those questions. And it's not normal to have those things.
No, or like they'll stay home from work like, once a month, which is totally not, that's not like a functional way that you should, even though that's what you've been having to do. And a lot of people now I notice who work at home, they're like, yeah, it's horrible, but I'm at home. I think that there definitely can be, those are things that can be brought up for sure.
Absolutely. And in some instances, I mean, women can even bleed through their clothing. It really affects the quality of life. It can lead to severe anemia. Some women end up with IV iron treatments or blood transfusions. We certainly don't want it to get to that point. So again, I think it's really important to realize that you want those symptoms addressed early if possible. Diagnosis is pretty straightforward. We typically start with an ultrasound, which is easy to do and quick to set up. And if there's any questions with regard to the results, or if we need more information to differentiate between different treatment options and what's the best fit for the patient, we often get an MRI.
When you come to the doctor and we do an exam, you can feel it. Most of us will confirm it with some kind of imaging study, but when you feel someone's uterus and it feels enlarged, so even a doctor's visit can give you some indication.
100%. So in-person visit is really important. Pelvic exam will give you a lot of answers, and then to narrow things down and become more concrete, you need imaging.
Yeah.
Got it. So come in if you have symptoms and for your yearly exam. All right, Dr. Friedman, do fibroids cause infertility? How do they affect pregnancy?
I would say generally no. I think, most fibroids are, found randomly. So they can be found on like an ultrasound during pregnancy. Like you'll see, oh, there's a baby, oh, there's a fibroid. That's how a lot of them are found, because often they don't cause problems for people. If they are large enough, they could theoretically make it difficult for an embryo to implant. It could make it difficult for a fetal growth, for the uterus to expand, or it could make it difficult, like the baby goes through a number of movements in order to be had down at the time of delivery. And so it can impede that. So sometimes babies can be in the wrong position potentially for a safe vaginal birth. So I don't think like fibroids and fertility is a cut and dried topic. It's something that's very individualized, but I would say in generally, not really.
Complicated formula, right? We always tell patients that there's so much variation on the theme. It's a disease that's hard to generalize with. And so it's like a complicated puzzle that your doctor will put together. What are your fertility plans? What are your symptoms? What do the fibroids look like? What are your plans for pregnancy? So that's where those nuances are really important to sort out, and they're highly individual.
Okay.
That reminds me of the other thing too, is like, it's not just size, it's also the location of them. So that's another thing that's helpful on imaging, is that like you could have a 1 centimeter fibroid that's in a place that's actually causing you a lot of problems, or you could have a 1 centimeter fibroid that's in a place that we would tell you just, don't ever think about it again, so it really matters exactly where it's located too, in terms of like the muscle of the uterus. It can be several different places.
Yeah, and I always tell patients the key is really number, size, and location. And that's the information I look for in imaging reports, in addition to, of course, symptoms and other factors we've covered.
Great. Dr. Lerner, can fibroids become cancer?
Good news, fibroids are not cancer. They're completely benign. So that's a sign of relief a lot of patients will have when they hear this. But it is important to realize that there is a rare cancer. It's called leiomyosarcoma that actually mimics benign fibroids. So luckily, it's extremely uncommon, but there are some concerning signs, like just as an example, a woman was completed menopause, the fibroid should be dormant, but all of a sudden the fibroid starts to grow. That's concerning. Some findings on imaging sometimes can clue us off. But in general, again, I don't want to list forest for the trees. It is incredibly uncommon to have this cancer. Fibroids are benign, but again, it's nuances, it's details. It's something that you should sort out with your doctor. And, it's not important. It's important not to ignore your symptoms.
Totally. And I think also, like, don't be misled if we're like calling it like a tumor. It's not, there can be benign tumor that's, just like we just think of it as like a muscle blob, basically. Your body needs lots of blobs, some people more than others. And it's just called a tumor because of its shape.
Dr. Friedman, who is prone to fibroids?
Well, they're super common, 50% of women. So just being female puts you at 1 out of 2 risk. They are more common in African Americans, and they do tend to appear later in life. And I think part of that might be that they are, like Veronica said, they're stimulated by hormones. So, a lot of people start to be affected by them, I would say like 30s, 40s, but generally, I would say African Americans are probably about 2 to 3 more times likely.
Okay. And how does menopause affect fibroids, Dr. Friedman?
Menopause often can be very helpful for fibroids because once you stop making estrogen, then the fibroids really respond to the hormones. So they kind of they're sort of cut off, so they often will shrink. And often for a lot of women who are sort of struggling with fibroid symptoms, they're kind of like limping along and to get to menopause so that their bleeding will stop, because if you're anemic and bleed heavily, then that's amazing to have that stop. And then they can be if they're large and cause bulk symptoms, they do tend to shrink. So I would say generally menopause is helpful for fibroids.
Absolutely. And as a surgeon, just to add a small thing to that, it just depends on what you're starting with, right? So yeah. Let's just say uterus is normal as the size of a small pear. A small organic pear, as my patient told me. She's like, well, what kind of pear is it? Is it small or is it organic? Is it regular? It's organic. But let's just say it's the size of a small pear. If you have a grapefruit-sized fibroid or a cantaloupe-sized fibroid, menopause may not give you relief of those bulk symptoms because, of course, it will stop growing, shrink some. But if you're experiencing a lot of the symptoms that Dr. Friedman pointed out, that might be something to consider during a discussion with your doctor. Am I going to get enough relief with XYZ treatment? Am I going to get enough relief if I just wait it out? Yeah.
And I think like with the fruit, I often say the fruit thing too. Like it will describe your fibroids the size of a fruit. And it's really, it's not to like minimize them or like, make them feel insignificant or you insignificant. It's just the best way that we can think of to kind of give you an idea of the size. So I say that a lot.
Mm-hmm. Yeah. So let's talk more about treatment. Does everyone need to be treated? And what are the most common types of treatments, Dr. Lerner?
Of treatment, as Dr. Friedman mentioned earlier, there are a few options. I tell patients there are 4 general categories, waiting it out, as we kind of touched on, and I'm sure you can talk a little bit more about that. Medication, which helps to usually mitigate bleeding, although it does not always successful. So there are different categories of medications to choose from. And then surgery, of course, removing fibroids. And then the last option is procedures. With uterine artery embolization and radiofrequency ablation being the 2 most common ones.
Okay, so Dr. Friedman, do you want to talk about what medications are commonly used for treatment?
Commonly, we will just observe, which that means basically, every year at your exam, kind of reassessing for some of the symptoms that we talked about, bleeding, reassessing blood counts, any bulk type symptoms, things that can help people stop bleeding from fibroids, birth control pills that has estrogen and progesterone generally. There are some hematologic or like blood altering type of medications that alter like the clotting mechanisms to decrease the amount of bleeding or increase the clotting. There's a medication called distended that does that. A lot of people, depending on the size and location of the fibroids, do quite well with a hormonal IUD. So there are a lot of 2 types of hormonal IUDs that dramatically decrease uterine bleeding. So if your fibroids haven't sort of changed your uterine cavity so much that you can't put an IUD in, that's also an excellent treatment. There are a couple of newer medications that combine sort of a oral contraceptive or a birth control pill with a medication that can sort of is more of a short-term type of bleeding stopping medication. And those would be more for people, I think they're not long-term. It's more maybe like a bridge to getting you to a point where you have a procedure or something like that.
Okay, Dr. Lerner, let's talk about your field. When do you recommend surgery and what are the different surgical options available to women?
Well, surgery is always on the table because we mentioned earlier, it just depends on what the patient's goals are. Where they are. I appreciate the surgery joke. I don't know if I can get back to you with the office jokes, but I'll try. So Yeah, so it just depends on multiple factors. If you failed prior treatments, or if you don't want to kind of play with medicines and try to see if one would work, or if it's impacting your fertility, or if the size is so big that we don't think other measures would be effective, those are all some examples as to why women will opt for surgery. Think of surgery as two categories. One is hysterectomy to remove the uterus together with the fibroids intact. And the other one would be myomectomy, which basically is a technical term to describe removing fibroids and leaving the uterus in place. In general, women who want to preserve their fertility or they want to conserve their uterus opt for myomectomy. Hysterectomy is more definitive in a sense that after hysterectomy, the fibroids can't come back, because oftentimes we struggle with recurrence, and that's another issue to discuss with your physician. And most important, I think, in terms of surgery is to realize that we do not need to do open surgery for this. Open surgery, laparotomy is technically the term for it. Think of it as like a C-section type of incision is how surgery has been done traditionally. But now we have laparoscopy, minimally invasive techniques, basically, that allow us to do surgery through small incisions. And that makes a huge difference in terms of recovery. So less pain, faster return to normal activities, and of course, decrease in surgical risk, which is what we care about: infection, scar tissue formation, bleeding, all those things. So big picture, laparoscopy or minimally invasive surgery is the key to finding a surgeon who can do this for you. And it's really just to keep in mind that I would literally say most of the myomectomies and hysterectomies can be done that way.
Okay. What's the recovery difference between the two, Dr. Lerner?
Open surgery, you stay in the hospital for a day or two. It takes 2 to 3 weeks to kind of get back to your daily activities at home, and women usually return to work within 4 to 6 weeks. Laparoscopy, you go home the same day, so no in-hospital stay is necessary. You're not taking any narcotic pain medication, although you do need to be on pain medication regimen to help you get around and make sure your pain's controlled. And then within a week, really, you're just doing your day-to-day activities, your off pain medications that you don't have to take them on a regular basis. It's pretty amazing. So it really shortens your recovery quite significantly.
There's got to be like occasionally someone that can't be done.
Yeah, of course. So, some example, let's just say instead of 20 fibroids, we see 40. Yeah. Or, in some really rare circumstances, let's just say the uterus is so large you don't have even space on the abdomen to place trocars for the instruments to fit through. Those are like rare circumstances, but I would say more than 95% of hysterectomies can be done laparoscopically. And with regard to myomectomies, we think it's like close to 80%. So
really wow. And the techniques are getting better and better each year.
It's so just, our surgical techniques literally exploded. I don't know what else to call it other than a surgical revolution that happened in the last 10 years. We've advanced so significantly that it really makes a huge difference.
All right, great. Dr. Friedman, are there other procedures besides surgery? What is a uterine artery embolization?
Uterine artery or fibroid embolization basically involves a radiologist or an interventional radiologist who puts something like a little bead type thing through your groin and into the arteries that supply the uterus. And the goal is to decrease the blood supply to the fibroids, because just like menopause, when there's decreased blood supply and hormonal stimulation, it could decrease the bleeding and decrease the size. So it's an outpatient procedure. There are some interventional radiologists that do many of these. And so if that's something that people are considering, we'll have them go ahead and meet with them for a consult to see if they're a good candidate.
Okay, Dr. Lerner, what is an ablation procedure?
Yeah, so this is a fairly new technique. By new, I would say, our medical community has been exploring it for over a decade, but in the last couple of years, when it has really taken off more. With ablation, which can be done through the cervix without any abdominal incisions with the guidance of ultrasound, or it can be done laparoscopically through small incisions going through the abdomen. A special metal rod is placed into the fibroid, and there are smaller rods within that kind of open like an umbrella. So those little prongs will penetrate the fibroid, and using electrosurgery, the fibroid is ablated. Basically, the heat is applied in a specific way to it. So that leads to reduction in size and the fibroids become less active. So as a result, after this procedure, the fibroids shrink and the bleeding improves. So again, with embolization and with ablation, the fibroids don't go away, but it's the symptoms that we're after. So if we're able to reduce the size sufficiently, if the bleeding improves, that's really the goal.
And they're just choices, right? Like, I feel like there are some people who are better candidates for one thing or another. And so they're options. They're not options for everybody. You'd have to talk to your doctor about, like, you know, what are your concerns? What are your symptoms? What are your goals after? That's kind of how I think about it.
Yeah, and we would love to tell you is say, like, look, these are options. This is what you would see from just general outcomes and the population, right? And this is how it specifically applies to you.
Yeah.
So, you know, if you're a little bit older and you have a small uterus, for example, embolization is more likely to work. But if you're younger and you have multiple fibroids, we know that it's probably not going to be the best, especially if you're planning to have children. So it's really, as I mentioned earlier, there's so much variation in how the fibroids affect women and different goals, different risk factors, that it's important to tailor it.
Yeah, so it's important to come in for a discussion. We have a question from the chat box. Let's see. Can fibroids come back essentially after treatment? Is there anything a woman can do to prevent them from reoccurring? Dr. Lerner.
Out of your head, so
we can talk about it together. Yeah, so that's really the challenge. I mean, our medical community, surgeons, researchers, doctors, we're all working trying to figure out how can we combat this issue. Because unfortunately, even let's just say after a successful myomectomy, I'm just going to use surgery as an example, fibroids come back. Why? Well, it's because there are new mutations. Like I mentioned earlier, the tumors arise from what looks normal to us, right? It looks like a normal muscle wall, normal muscle cells, but 5-10 years down the road, it may mutate into another fibroid. So that's really the challenge. So we know that women do well a few years after treatment, but it depends on what we call fibroid burden, or how many fibroids that they have before the treatment, how old they are. That determines how quickly they come back. So usually in general, I mean, again, it's hard to generalize, but usually women are fine for a few years. But if you're looking at 5 to 10 years, that's when you start to worry about recurrence, and we call symptomatic recurrence, meaning like the fibroid grew back and it's causing bleeding and pain.
So you have to follow up with your gynecologist on a regular basis then. All right.
Yeah. I mean, it's always disappointing when they do come back, but I think most of us know that that's how they behave.
Got it. Okay, last question. If you had one action step to recommend to our viewer to improve their health and start today, what would it be? Dr. Lerner, do you want to start?
Yeah, I think for me, again, as a surgeon working with a community of gynecologists and, closely interacting with patients and doctors, it's just important, I think, to address your concerns quickly. And if it's not normal, something doesn't seem right, or even you have a question, that's the important time to bring it up. Because sometimes patients get caught off guard when the fibroids are large, or when it has progressed further than one would expect.
I think all of us, being human and patients ourselves, we feel like maybe the doctor didn't hear us or didn't hear exactly what's bothering us. Like, so my point is, if you talk to somebody about it and you feel like your concerns aren't addressed, or you still have questions, or if you feel dismissed, make sure you follow what you feel. If you're concerned about it, get a second opinion, because you know yourself best. And, sometimes finding the right person, like the right doctor who is going to take the best care of you as an individual, it takes time to figure that out. So, like, if you feel dismissed or ignored, don't allow that for yourself. Like, just keep following your instincts and seek out somebody else.
I echo that too. As a surgeon, I always say, like, my number one mission is to empower you. To take care of you. So I couldn't agree with that more. It's really important to get to that point where you feel like you're being heard and your concerns are addressed.
Yeah. Well, that's the mission of Concorde Conversations, to empower patients. So thank you all for joining us for another inspirational and educational episode of Concorde Conversations. A very special thank you to Dr. Friedman and Dr. Lerner for joining our conversation today. We appreciate their expertise to educate, encourage, and empower our community. As part of the Concorde community, we hope you will share in our mission. Please pass along our emails and webinar links to your friends and to your family. In addition, please like and subscribe to our YouTube channel. Finally, please fill out the survey at the end of our conversation to let us know how we can serve your needs better. We know that you will have additional questions about your health, and we want to help you. So come in and speak with our extraordinary Concorde physicians. We care about you. We care about your health. Thank you so much for joining us today. Have a wonderful day.